Hello, everybody. It's your podcast producer, Casey Callanan. I just want to let you know that as of October 1st, 2023, this podcast has had nearly 80,000 total downloads and YouTube views from listeners in 84 different countries. On the facultyfactory.org website, we've drawn nearly 40,000 web visits from users in 122 different countries. This is truly an international platform, and we'd love to invite you to be a guest on our show. Our host, Dr. Kimberly Skorupski, makes the experience very engaging, relaxing, and quite frankly, she makes it fun. As producer, I'll make the edits if you need it, so there's really no pressure on you, and we can make edits to your interview on the back end if you'd like us to. We just want to hear from different faculty around the world so we can all learn from each other. Please reach out if you'd like to be a guest or to nominate someone in our academic medicine community that you think would be a great guest for us to hear from. You can visit the Contact Us page on facultyfactory.org, or you can contact Dr. Skorupski directly at kskorupski@jhmi.edu.
Hello, everybody. You're back at the Faculty Factory, and I'm Kim Skorupski, sitting here at Hopkins. And reminder to everybody, this is an international podcast. I was talking to somebody at our conference, which was in Indian Wells, California. It's the Association of American Medical Colleges. This year was a joint conference between the Group on Diversity and Inclusion, GDI, and the Group on Faculty Affairs, GFA. And people were talking about the podcast, and somebody said, "Oh, it's great that you have that for Hopkins." And I kind of like grabbed him and said, "It's not just for Hopkins, it's an international podcast." So I hope you're getting the message that this is not, I happen to be sitting here at Hopkins, and my boss graciously supports this effort, but this is an international community. And sitting with me today, as evidence of this being an international collaborative venture, is Dr. Meryl S. Cohen. Hi, Meryl.
Hi, Kim. How are you?
I am so happy to see you. I love your energy. We met last week and talked about stuff and podcasting and your position. But folks, let me tell you who Dr. Meryl Cohen is. She is an MD, MSED. She is a professor of pediatrics, the Associate Dean for Faculty Development at the University of Pennsylvania, the Perelman School of Medicine. She is also the Associate Chief in the Division of Cardiology at the Children's Hospital of Philadelphia, commonly known as CHOP. I was looking at her online and learned that she is a pediatric cardiologist specializing in fetal and transesophageal echocardiography. I'm not sure if you still are, Meryl, but I see that you used to direct the cardiology fellowship training program. You do.
I used to.
You used to. So yep. A really broad, many hats, many leadership roles. So interesting. I love that you're with us on the podcast today. And Dr. Cohen and I were talking about resourcefulness and how to be resourceful. And Meryl and I were talking about how sometimes we get the impression in our faculty development roles that faculty members feel constrained or limited. They feel like they have to do things. They woulda, shoulda, coulda, all these forces pressing down on us. And sometimes feeling like we don't have personal agency to decide how we're going to do things and how to make our path. So I think you're going to love learning from Meryl Cohen today. She's going to talk about how she's been resourceful throughout her career. Thanks again, Meryl, for being here. Why don't you tell us about your journey, and then we'll just kind of have a conversation.
Thanks so much, Kim. I think my resourcefulness came out of desperation. So sometimes, when you're desperate, you tend to do things that really, in the long run, may help you out. So thank you so much for having me here with you today. It's been such fun for me to get to know you and hopefully continue to collaborate with you in our roles in the Dean of Faculty Development. And that's a new role for me. It's been extremely exciting. I started out as a pediatric cardiologist trained here at CHOP and had no idea what that career would really mean and sort of what the criteria would be for me to essentially get promoted, through the academic track here. And so I sort of put my head down and just started working. And so one of the first things I tried to do was become really good clinically at what I did. I think that if you contribute to your field in a meaningful way with your colleagues at work, if they trust what you do, and that takes, by the way, years. You don't come out of fellowship knowing how to being an expert in something, and you don't come out with people trusting that you know what you're doing. So it takes patience, which I'm not very good at, and determination, and a little bit of grit to sort of make mistakes along the way and learn from your mistakes and try not to make the same mistakes again, and to sort of create an expertise in an area, a niche of your field where people ultimately start to trust you and think that you're a good clinician. So I think that was one of the first things I was trying to do. At the same time, in the kind of track I was on, which is called here at Penn, it's called the clinical educator track, which is a track, an academic track that requires that you have expertise in the clinical realm, in education, and in research. And so I really did not know how to do research. So I had to sort of learn along the way and take some classes while I was still an attending physician, and try to learn statistics and how to sort of develop a research protocol and how to write. I wasn't a very good writer in the beginning, and so I had to learn how to do that. And then also be able to teach residents and medical students and fellows ultimately. And all of those things sort of are related to each other. And at the same time, you're trying to build a practice, and you're trying to ultimately develop not only a reputation at your own institution, but regionally, and then nationally, and then ultimately, if you continue to go on, internationally. So these were all tremendous challenges. I had a 8-week-old infant when I started my fellowship, and then had 2 more children early on in my career. So in addition to all this, I was trying to manage having children at full-time job and being a full-time mother, which was also challenging. So I think that some of the ways I was resourceful, particularly during fellowship when I had a very young infant, I really became good at time management. Lots of people in the fellowship program, because they didn't have children at home, and this is nothing against them, but they could sort of lounge around in the fellows room and chat about stuff and, get to their work eventually. And I knew I had to get home to feed my son and to be with him because I had been away all day. So I was really, really organized, and I always sort of got my work done. I was not going to be the last person to leave like people thought you had to be. I knew I had to get home to be with my son. So I got really good at being organized. I think that has carried through ultimately in my entire career, that I'm pretty good at time management, and I'm pretty good at multitasking in that sense. So that helped me along the way. I did ultimately, a few years after I finished my training, I did ultimately hit a wall where I felt that I could not continue to do the amount of work I was doing at work and be successful there, and also be successful at home with my family. I have a wonderful husband who was he was terrific about, helping take care of the kids. We really shared the responsibility. So that part was good. And we had fortunately a good daycare system in place. But I was feeling really badly about getting home at 6 or 7 o'clock at night, and my kids were at their worst, and all I wanted to do was throw them in bed and not, interact with them. And this was just not a good situation. So this was where I think some resourcefulness came in, because I kept being told that I could not work part-time on the track I was on, that, that didn't exist. That was not a part of Penn's system. There was no ability to do that. But it turned out that there, of course, was a little paragraph in the bylaws of the university that a person of power at the institution who I went to, saying that I was really having this difficulty and struggle, found for me. So this person was really incredible, and found this resource for me, and enabled me to then go to my division chief and say I wanted to go part-time for a period of time. It added an extension onto my promotion clock, which I was fine with, because I was at an assistant professor level, ultimately getting to associate professor. And it enabled me to work part-time for 2 years. I worked 50% time. And, what happens when you work part-time, people have to understand, is you work more than you're paid for. So that's, just a reality.
Of course.
And you also, you're not as respected in your community as you were before because you're not there as much. So, the people who are there every day are sort of the go-getters, and you're considered not that anymore because you've stepped back. That was very hard for me to accept. And so I think I worked even harder to make myself known or present when I was here. And I did allow myself to be accessed even during times when I was theoretically off, which I actually don't think is a good idea, but I did do that. And this was 25 years ago. So it's, sort of different scenario now. Anyway, I did that for 2 years. It really helped offset a lot of my stress with my family. My youngest child then entered kindergarten, so I felt very good about going back full time. And I really was re-energized when I went back full time. Some people like to continue part-time work, and I think that's fine. And that works for a lot of people. But I did feel the need to go back to full-time work and was very happy I did. So those are some of the things I did early on. I found that I was not an outstanding researcher. I was a good researcher, but I wasn't outstanding at it. And so I had to find other ways to make myself successful so that I was going to ultimately get promoted. And so I was given a leadership position too early in my career. I became the echo lab director at CHOP. I think I was 5 years out of, maybe 4 years out of my fellowship. That's extremely early. And I took it reluctantly because my division chief asked me to do it. And of course, that took a lot of resources or a lot of my time, and took it away from other things that I needed to do for my promotion. You don't have to be the echo lab director to be promoted, but you have to produce peer-reviewed publications and do your teaching and, be clinically very competent. So I knew that would happen, and it did. So what I decided to do in that case is, try to really bring in fellows and medical students and residents to help me with my research projects. So it was a win-win situation because they get a first author publication and I'm the senior author. And so I don't have to do all of the groundwork that's required for the projects, which I did not have time for and did not have protected time for. But it allowed me to mentor, sort of students, trainees, and become a senior author on publication. So that was sort of a way that I got through some of the research part of it.
Meryl, can I interrupt you? So I'm putting this in a timeline. So this Echo Lab director position, you said after your fellowship, this is before you went to part-time status. Yes?
No, it's after.
This was after. Yeah. So when you come, this is now you have come back.
You're
still an assistant professor?
Yep, I was an assistant professor.
Okay, so now you're running the lab and you're getting the senior author papers. Okay, go ahead. I just want to make sure I would have it ordered.
No, that's totally fine. Another thing, I was given an opportunity, but took it, was that we have a NHLBI run Pediatric Heart Network. And so this is a network of several institutions which do research projects together. And another great way that you can get research accomplished without I'm going to say the grunt work, if you will, is to do a multi-center, multi-institutional study. And so some of those studies I was a middle author on, but some of them I took the initiative to either be first or last author on. And this was a huge, these are high impact papers in high impact journals because they're multi-institutional studies. We're a very small community, pediatric cardiology. In the adult world, when you do a clinical trial, it's thousands and thousands of patients. In pediatric cardiology, when you do a clinical trial, it's maybe 100, 200 patients. So very different, sort of very different resources. In any case, I got involved in that, and that enabled me to get really involved in doing a number of publications that were high impact and have subsequently still been referenced many, many times. And this is all because, I sort of got involved in this because I was asked, and I was very happy to be involved in it. And it also connected me with a network of people across the country who do what I do. And so these kinds of multi-institutional organizations are fantastic for young faculty. They really sort of get your name known, and they get you out there and also get you to meet important people. I met extremely important people in my field this way. Another thing that happened was that is sponsorship. So my sort of mentor here at Penn or at CHOP was a fairly well-known pediatric echocardiographer. And when he became a program chair of a national committee, relatively early on in my career, he asked me to give a talk. So that was my first national talk. I was incredibly nervous. I misspelled people's names up on the podium who were sitting on the podium and embarrassed myself. But nonetheless, I gave that talk, and that led to other talks in that meeting subsequent years by other people asking me, which then led to me being asked to be on the Pediatric and Congenital Heart Disease Council of that organization. And ultimately, I became the program chair of the pediatric program for that organization. So that one talk from my sponsor, led me to get really on the national scene and get involved in national committees. Now, when you get involved in national committees, I will, let the young people in the audience know that if you get involved in these, you say yes to the things that you can take on, and you make sure you do what is asked of you, because it's not a title, it's actually work. So if you say you're going to do it, you do it, and you do it on time. So getting involved in writing committees, which is wonderful and a great experience, getting involved in national committees, you have to be resourceful. You have to come up with ideas. You have to go to the meetings. You have to participate. And so I was really eager to do all those things. And so that national organization led to me being asked to do other national organization stuff for the American Heart Association, the American College of Cardiology, and this organization is called the American Society of Echocardiography. All of these organizations gave me tremendous national presence and opportunities. So those are other ways that you can be resourceful. Many of these organizations, not just in cardiology, all over, have early career opportunities. So they have they have sort of subcommittees within their organization for early career faculty to start to shine. They come and they have, they have research competitions. They often have sort of luncheons for mentor mentees, all sorts of things. And that's really how a lot of young academic people can get involved in these types of organizations. And once you succeed in the early career pathway, then you move on to other sort of parts of the organization. So those are some of the things that really helped me, in my desperate attempt to get promoted from assistant to associate professor. I will say that at the time, and this was a long time ago, what you got from Penn in your reappointments were these warning letters. And so I want people to know that you can still succeed even if you get such a warning letter. It can be quite devastating. I still keep those letters in my drawer, so I remember them. And it said something along the lines of, "We are very concerned that you are not going to get promoted." I got it at year 3 and at year 6. Yeah, exactly. Now, what didn't happen, which happens now in our organization, but didn't happen then, was they didn't give you any resources or they didn't really discuss with you what the problem was or what you needed to do or how they could help you. So it was just basically this letter that I remember when I got I was so dejected. I just kind of threw it in a drawer and I thought, okay, what can I do with that? So we've come a long way from that. But I want people to know that even if they get warning letters like that, it's not the end of the world. And the idea of a warning letter like that is to alert you that you do need some help. You do need some help, along the way. And so, what you should do with a letter like that is, figure out what the issues are, meet with your faculty development people at your institution, try to figure out what the problem is, and then, potentially going to your division chief or department chair and saying you need this a period of time, to sort of get through something so that you can succeed. So it may be that you need a 6-month period of more protected time so you can get a grant in, or get this like big paper you've been working on over the hump and get it submitted, or organize a course that you want to participate in or be the leader of. So I want people to know that you can get those and you still can succeed.
Meryl, I love your honesty. Thank you for your candor. I love the way you just said this, I get these warning letters and look, here I am, a professor of pediatrics, a dean for faculty development, and I still keep my warning letters that we're really concerned about your being successful. Wouldn't you love to be able to hold that up and say, during the interview, to be like the dean for faculty development? And by the way, I used to be a problem child that people were concerned about me.
I was definitely a problem child. There's no doubt about that.
I've told this story before. I had so many unscored grant applications. I was going in every funding cycle for NIH for an R01, every one, Feb 1, June 1, October 1, October 5. I was doing all the cycles, mad, like a mad woman, just trying to get funding, and it wasn't happening. And I was keeping track of all of them.
Oh, sure.
Unscored, triage, unscored. And my friend said, "Why do you put those on your CV?" And I said, it makes you look like a loser. Like you're just not getting things. Like, what is wrong with you? You're not. I said, I want them to know I'm in the game. I'm swinging. I'm at that. I'm trying. But it is that kind of authenticity is refreshing. So thank you, Meryl, for sharing.
I think that people need to know, first of all, it's similar to your grant story. How many papers I've had that have been rejected multiple times by multiple journals. And, to me, if it was easy, we wouldn't be doing this. I don't know. I find that sometimes the new generation of people want things to come easier to them than they tend to come. And I think that, being resourceful, having some grit, having some determination, and being able to take it when you are rejected, and then picking yourself up and then just moving forward is an incredibly important characteristic to have to help you succeed. If it came to us all so easily, it wouldn't be worth it.
There'd be no challenge. Yeah, you're right. It's so fulfilling when you have a challenging problem that you kind of work hard. It feels so much better than that was no biggie. Anybody could do that. It's something psychological, I'm sure.
Right. I wear being professor of pediatrics here as a real badge of honor because I know it was really hard to get. If it was easy to get, it wouldn't have the same meaning to me at all.
You're exactly right. If you wouldn't mind, I'd love to kind of go back to your story because I underlined some things that you said that I hear so often. I would love for you to kind of dig a little bit deeper. So you start off with saying desperation, the desperate times called for desperate measures. And thank you again for sharing. I'm imagining you with an 8-week-old little boy and, you running across and just hitting that wall and saying, all right, something's got to give here. Yeah. So you described that experience. And could you take us back to, let me step back before that, because you right away said I was on the clinical educator track that's called, there at Penn. But first of all, how did you know you wanted to be on the clinical educator track? Because I have faculty who are saying, well, I don't know what I want to do. It's so early. And as you nicely laid out, the first step in the door is I want to be good at, Abraham Lincoln says, whatever you are, be a good one. If I'm a cardiologist, I want to be a darn good one. I want to be an excellent one. If I'm going to be a basic scientist, I want to be a good one, et cetera, et cetera. So we do what we know we are trained to do, that the certificate, the diploma says we can do. So we focus on that. And then quickly after coming to our institutions, we're asked to choose. How did you know? Or was it easy? Was it a no-brainer? Did you do like some of us do in undergraduates, change majors? How did you come upon that decision?
I wish I could tell you it was a very meaningful decision for me. But honestly, at the time, that was the only track really I could be on. So, Penn in the early days had 2 options. Well, 3 options. You could just be you could be a clinician and not be on an academic track. Or you could either be on the clinical educator track or the tenure track. So the tenure track was, sort of required funding, et cetera, mostly somebody who's protected about 80% of the time for their research. So knowing that I wanted to be a clinician, I went to the CE track. Now, today we have several other tracks available too. So it is a harder decision for people as they're starting to know what they want to do. And in all honesty, I'm not sure that I would have been on this track had I had the options that are available to us today. So there's now a track at Penn, and I'm sure there's one at Hopkins and other institutions that sort of evaluates you on your clinical abilities and education and teaching, but you don't have to do the research component. Yeah. And here it's called the academic clinicians track. And so, I might have gone on that track. I'm really glad that I didn't in the end, because I did get to have this research experience and research career that I found very satisfying. So I'm glad that I didn't. But I wasn't given that option when I started.
Got it. So that's helpful. And I think what you laid out so nicely is you described to me a career arc where through a series of events that hitting that wall of saying, wait a minute, babies, something has to change here. Hard stop. I can't do multiple full-time jobs. And then being proactive and intentional in saying something has to change here, going to part-time. You also describe situations where you're investing in relationships with mentors and sponsors and trainees. And you laid it out so nicely with when you were the director of the Echo Lab and saying, okay, I got residents and fellows and students, and how can I help everybody win? That all is you're building relationships. So that sounds to me like you've been able to navigate the career by intentionally, thoughtfully asking mentors, asking sponsors, getting in the professional society, asking that putting yourself out there. So it's not all reactive. You kind of had the head on the swivel, it seems to be. Am I kind of hitting that right?
I think that's right. I think, in my own institution, I did have some mentorship, but I didn't have everything I needed. So getting involved in that pediatric heart network enabled me to seek other mentors at other institutions in my field. I sought a mentor at my own institution who was not in my field, just so that she could give me her perspective on where I was when I was really concerned about how I was doing. And I would meet with her on a monthly basis, and we would go over my CV and the things I needed to do. So I found people, I reached out to people, and, I sort of honestly advocated for myself to try to get myself where I needed to go, because in some areas here, I wasn't getting what I needed from, sort of my own leadership. So I sort of actively sought those kinds of experiences. And, it helps that I'm a friendly person. I really like people. I like being with people. When I give a talk at a meeting, I always, you always thank the people who gave you that opportunity. You reach out to others, and you show other people's research, and, so that they sort of appreciate you. These are things that people sort of know, but not everybody does, to be honest with you.
Thank you for saying it that way, Meryl, because exactly, I mean, you definitely exude the energy that resonates with me. I too am an extrovert. I enjoy being in community with people. I get energized by people. So it is very squishy, huggy feel. It feels good for me. And yet, of course, we know our colleagues and friends who this is not natural for them.
That's
and
correct.
then I'm hearkening back to COVID, when the world shut down for 2+ years, clamping down so many opportunities for faculty members who may be more introverted, maybe more shy, maybe don't have that confidence. So it's even more, it's a greater challenge for some faculty members to do the things you're describing that is just very natural. So I always struggle with trying to give advice to faculty members for whom this does not come easily. Do you have any kind of like wisdom that you can help our friends?
I do think always having good mentorship and sponsorship helps in those situations. And to some degree, people have to understand that they have to get out of their comfort zone a little bit. So I took on this associate dean for faculty development at Penn. This is way out of my comfort zone. I've been a clinician educator for all these years. I was the training director for the fellowship program, so I do have that experience. But getting involved in really faculty development was really new for me. So I got a master's degree when I was 54 years old. And that also, being in the classroom again and having to write papers and have homework and things like that, was a really difficult and challenging experience over a 2-year period of time. That was way out of my comfort zone. I was with, it was me and a couple of other people my age, but mostly people in their, in their early 30s. And so, you do have to get out of your comfort zones. If you want these things to happen for you, you have to figure out ways that work for you, that enable you to reach out in these types of, because the community of your medical field is so important to your success. You can't do it alone. There are very few people who could do it alone. You need collaborators. You need to network. You need to get you sort of get yourself out there, and also take risks. I find in the clinical world that people are very quiet because they don't want to be wrong. I am not quiet, and my colleagues would tell you I'm not quiet at any time. But when I'm in clinical conferences, I put myself out there, and sometimes someone will say that's not correct. I'm like, okay. So what's the worst thing that can happen to you in that situation? You're not correct in that situation. It's not the end of the world. And so people are so fearful of those types of things. And I think they just have to be, courageous enough to know that they're not going to be right all the time. But if they're right most of the time, then people listen to you.
I love it. I love it. You mentioned earlier also, here's something else I wanted to revisit: time management. You're really good at time management and the multitasking. Can you give us a couple examples of when you said, your colleagues are lounging around and they're taking it easy. They're chatting and they're on the coffee pot, and you seem like you're a list maker.
I'm such a list maker. Oh my gosh, right. I am such a list maker. I always have my task list up on my computer, so I know sort of what I need to do and when I need to do it by. I write a lot of letters of recommendation for people's promotions now, which I think is a real honor because people wrote them for me. And, for the audience out there, I think these are very important tasks to do for others in your community. Somebody took the time to do it for you, so you should do it for others. Papers that are due or chapters that are due or a talk that I'm giving. So I have like the list up on my screen and it has all the deadlines on it. So I tend to sort of prepare my week knowing, okay, these are the tasks I'll get done. And I even put little notes in my daily schedule of the things I'm going to do that day. And the other thing I do for my administrative assistant, I'm fortunate enough to have one, is I block out times in my schedule for her not to schedule any meetings. Because otherwise, they sort of get put in your day. I'm sure, Kim, you have a million meetings every day. And in my new job, I have even more meetings. So I don't block the whole day out, but I'll block a 2-hour period of time, a couple times a week if I can. And I'll even go so far as to sort of call it something so that nobody will try to interfere with it. And I'll even put a little pad on my door that says I'm in a conference call so that nobody knocks on my door, because people tend to knock on my door spontaneously, which I love. Love people to come in and ask me questions about an echo or about a patient or whatever. So I will do those things. I will purposely put in my schedule the time to write a paper. People don't realize that that's a really easy way to get things done. And somebody taught me that years ago, and that was extremely helpful. Another resourceful thing, unfortunately, this is one of the things I'll be remembered for because in my field, because I've given this talk about, work-life balance many times, is get someone else to do some of the tasks at home that other people can do. So I've always had a cleaning person. And when I was a medical student, I went to a women in medicine conference, and what resonated with me and came home with me was somebody said, like, don't clean your own toilets. And I was like, oh my God. Yeah, that's such a brilliant thing. Oh my gosh. Don't clean your own toilets. And so I've gone to many of these work-life balance things, and people will come to me years later and say, I took your advice. I hired a cleaner. And I'm just so thrilled that that's the thing that I will, sort of go down in history for.
Changing your life. Toilets, one toilet at a time.
Yeah, one toilet at a time. Yeah. And it could be anything, it doesn't have to be that. But if there are things in your life that you don't have to take care of that are relatively the cost benefit ratio is good enough, let somebody else take care of it so that you have the time to do the things you want to do, both at work when you're focusing on that and at home when you're home with your children. So, when my children were young, they're all grown adults now, but when they were young, I didn't want to spend a Saturday cleaning my house. I wanted to spend a Saturday at their baseball games or taking them to the park or whatever it was. So those are really important, sort of little tidbits of things that you can do from a time management standpoint. So it's not just time management at work. It's time management at home. And I tried really hard, no matter how much work I had, to get home for dinner every night. So my children ate later than other children. They didn't eat at 5:30. They ate at 7 or 7:30. But we would all sit down together and have a meal. And that's where I would sort of learn what was happening in their day. And it just brought us together at least one time a day if we didn't have other opportunities. And then if I had work to do after they went to bed, I wrote a textbook on nights and on weekends, edited a textbook with several other colleagues, but I wasn't able to do that during my 8 to 6 day. I had to do that, on my own time. But, if I was able to put my kids to bed, then I had an hour or two in the evening that I could do it, or I could do it on a Saturday morning. I know people want to be more present at home with their families. And I think that's incredibly important. But sometimes you do have to do a little bit of work on the off hours. And it's just important to organize yourself in a way that you can do it when it doesn't have impact on other aspects of your life.
Yeah, I love it. Meryl, you also earlier you talked about how you worked for a period of time when you were part-time, you were conscious of the feeling that because you were not present, that you were maybe a second-class citizen.
Yes.
And so you had to work hard. You said you worked harder to be known and to be present when you were there. And I'm thinking of that may have parallels to faculty members who maybe are in different promotion pathways or tracks or seasons of life, or in bridge funding, not getting funding, having life events happen, parents getting ill, children with needs, marriages having problems, all the things that happen in our lives. How can you take us back to that time in terms of being efficient when you are working? What kinds of things did you do to be more visible, to make sure that you had the full impact, to maximize your impact when you are on during all this chaos? What kinds of things do you remember doing that made you feel like, all right, I'm present, I am here, and see me?
Yeah, I think I took a lot of risks in my clinical sort of opinions. So I started to make my clinical assessment opinions known. So in my world, the highest risk situation is when you're in the operating room with the surgeon and you're doing a transesophageal echo, which is assessing the repair that they have just done on a congenital heart disease of any type. And it's a real high risk situation in that if I miss something on that, transesophageal echo, then that child could potentially be injured. They may not survive the operation, or they may have to come back and have another procedure done, which is devastating to the family, to the patient, and, ultimately to the surgeon too, who has just done the procedure and thought they did an okay job. So I had to really feel confident in what I was seeing and be able to communicate that effectively. So I really learned how to communicate well with the surgeons, and each surgeon has a different personality, so you have to do it a little differently, and also be able to tell them when I didn't know something, never be confident if I wasn't confident, and ask for help if I needed it. And I think that those kinds of things have always helped people get better at what they do. And so I really was very purposeful in making sure I always asked for help if I was not confident in a decision. And I think the surgeons seeing that, you build a trust with them, and they start to develop a rapport with you where they trust what you're saying, and they trust that you will ask for help if you need it. So they're not going to have to ask for you. You don't want to be arrogant about something. You don't want to be sort of pompous and say, I know all of this. I didn't. And so I had to learn along the way. And I think those are some of the ways that I tried to be really resourceful at work. And I volunteered, even though I was part-time, to get involved in some, sort of CHOP organizations and committees, and was an active participant in those things because I wanted to be, even though I was working part-time, I wanted to be a good citizen when I was here. So I wanted to really be a part of the community. And that helped me learn, we're such a huge organization here, as you are at Hopkins. And, we live in our own sort of bubble. And so to extend myself and meet a hematologist or a oncologist or an infectious disease specialist and, build community with them. Sometimes that led to a research collaboration or a teaching collaboration of some kind. And so usually when you open a door in your life, it's going to lead to something good. It almost always does. So that's what I was always trying to do, even when working part-time. And then when I came back full-time, I sort of, let everybody know I'm back and, I'm ready for all this. And it worked out really quite well. So I'm really glad I had that time. I became a terrible potter. I tried to learn how to play piano and I was really bad at it, but I kind of enjoyed it. So I did a few things that even were not related to my children during that time. But I'm so glad I had that time with them. I was able to take them, to their music classes, pick them up and take them to school and go into their classrooms to read and, the things that you want to do, for your kids when you're working full time. It's hard, but I was able to do that. So anyway, those were some of the things that I did.
I love how you just talk about terrible potter, playing piano badly, getting my rejection letters. You're so humble. But it also, it shows.
Oh, if you saw my pottery, you would agree with me.
The lesson I hope people are hearing, especially early career faculty members, is that you don't have to be perfect.
Oh.
You look at this as you just try it. And what Meryl said, what's the worst thing that can happen? You have some really ugly, bad pottery. Oh, well, what happens? That project doesn't go forward. Or, you can take a class and learn how to do statistics. And then you're like, I don't want to do it. I'm going to have, the biostatistician do it. Or I'm going to learn about this and doesn't really work out. I'm going to pivot there. What's the worst thing that can happen by taking risks? I don't know. I mean, I think that that we need to be sometimes having a little bit more courage. And I like how you laid out these principles that I think can go throughout our whole lives of being confident without being arrogant, and then being honest with yourselves and with other people, and then asking for help. That kind of, to me, builds a bedrock of your character. That if we can all start with that, own what you own. I mean, just own it. If you're good at something, you say you're good at it. That's not bragging. If you can actually do the thing, you're not bragging. You be confident in what you can do. Be honest about what you can't do or you don't know. And then, gosh, be courageous to ask for help. Isn't that kind of like the serenity prayer? Like, God, grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference.
It works, right? It works. And I would, one other thing is, own up to your mistakes. Whenever I make a mistake now, and even, all along the way, I let everybody know. In other words, I sort of want people to understand that, the more seasoned people here, now that I'm on the other side of this, as sort of a senior person in my division, that all of us still make mistakes. And I will always tell my trainees, the mistakes that I've made. I'll show them to them. I'll physically show them, oh, here's where I missed this thing. Or I decided this about this patient, but I really should have done this. I think that those are really important for people to know about because, we're all going to make mistakes. And, in medicine, it can be really devastating when you do. And I have had devastating mistakes. But you still have to, you learn from them and you have to forgive yourself of them. And you have to let people know that you've done this and that you're not going to make that mistake again because you've learned from that. So I think,
and you're setting a culture. You're also building a culture of this is the blueprint for how we do things around here. We are honest, we are confident and yet humble. And by my sharing my failures, you're learning from this. I'm learning, but you're learning. We're contributing to this knowledge base of we know what works and we know what doesn't work. And how can we mitigate these things happening in the future? And we can only do that. We can only improve by sharing the collective experience of where we messed up and where have we done well. That's only going to make us better. And I like how you clearly, not only in your personal character, but in the institutional culture, set this up of just as this is how we do business around here. Dr. Meryl Cohen, I love it. Thank you so much for your honesty. You are delightful. I'm so happy for you and so proud of all the work that you and I and we do together. And this being here together, this is so I really appreciate your honesty, and this means so much to everybody listening. And I'll leave the parting comments to you, Meryl.
No, thank you so much. I was so happy to meet you when I heard about, all the incredible work that you do at Hopkins, and I'm going to copy a lot of it. I just want you to know that.
Absolutely.
And, I was just thrilled to be a part of this. Thank you so much. It was a really great honor for me. And I look forward to us networking and collaborating in the future.
And it will happen easily, because that's what you and I do. And yes, this is a faculty factory where we share tools to build leaders, and we're all lifting each other up. So again, Dr. Meryl Cohen, thank you so much. Thank you for listening to the Faculty Factory podcast. Why don't you jump on and share your wisdom, or sponsor someone else to be on? Until next time, see you soon.
Thanks for tuning in to Faculty Factory Podcast. The mission of the Faculty Factory is to build and support a community of leaders in faculty development who share tools, resources, wisdom, and encouragement in service to our faculty members, schools, and institutions. We encourage you to go to facultyfactory.org to find out more. Get in touch with me, ask me any questions. Maybe you want to be interviewed on the podcast. Thanks for tuning in to Faculty Factory Podcast. We'll see you next time. The Faculty Factory podcast and website is sponsored by the Johns Hopkins University School of Medicine Office of Faculty. For more information, visit facultyfactory.org.